Hi, everyone. Good afternoon. Thank you so much for joining us today. Welcome to CACF's Teach-In as part of our 2021 APA State Advocacy Day. We're so excited that all of you are joining us. Sorry, I hear something. We stopped the music, sorry. I mean, I can talk about the soundtrack. That's okay. Thank you. So my name is Kaveri Samgupta. I am the Education Policy Coordinator at the Coalition for Asian American Children and Families, or CACF. And first off, I'd just like to introduce CACF's co-executive directors to give a little bit more information about our organization. So Vanessa and Anita.
Hi, folks. This is Anita. Thank you so much for joining us today with CACF. I hope everyone can hear me okay. Just wanted to give, for those of you who don't know who we are, CACF, the Coalition for Asian American Children and Families, is what we are in our name. We are a coalition. We are a broad coalition of very diverse Asian American community organizations, now in our 35th year, advocating for policies that support our communities, that fight for equity, for all of those New Yorkers who are most marginalized. And we're so excited today to share with you this teach-in that will really frame racism as a public health crisis. And CACF does its work through our coalition. We listen to our coalition, our community organizations' needs. We listen to the needs of young people, of parents. We every day are uniting across our community while we're also highlighting the diversity within our community. We're fighting every day for those of us who are most marginalized. And of course, we are shrouded by this model minority myth that is not true, that talks about our community in ways that are very harmful, but also pits our community against other communities of color. And that we're always on the forefront trying to challenge and bring reality to our communities, and hope that today that will happen with our partner organizations. And together we are building a community that is too powerful to ignore. Vanessa? You have to unmute. Okay.
Now I can.
Great.
Technology, I still don't get it. Good afternoon, folks. My name is Vanessa Leon, co-executive director of CACF. And we're so excited to have you all join us today. I think what we have, what we've always are committed to is that collaboration and alignment, and ensuring that, only together can we actually fight racism. So at the end of the day, we're also really, really grateful for our leadership at over the state legislature, including Senator John Liu and the APA task force and their members, who really helped to fight for a budget for us for the first time, and that our community organizations who are on the ground are so well equipped to be able to really meet the needs that have been really exacerbated by COVID-19, by the xenophobic and broad anti-Asian race, anti-Asian hate that has happened across the city, the state, and this country. So we're excited to kind of have our partners really highlight a lot of the work that they've been doing. And so I'll turn it back to Kaveri.
Thank you, Vanessa and Anita, for sharing more about CACF. Just wanted to talk a little bit about what we're going to focus on today. So today's teach-in really focuses on unpacking how racism is a public health crisis, including for our diverse Asian American communities in New York. And our Asian American children and families, similar to all children and families, really can't lead safe and healthy lives unless we tackle the real issues that we face, including poverty, overcrowded housing, and if we build health and education systems that really make the effort to support us and not render us invisible or dismiss our lived experiences. We have to focus on the social determinants of health that underlie the crises we see today. These inequities are a function of racist systems which have been laid glaringly bare by COVID-19. And communities of color and immigrant communities are often scapegoated in times of crisis. And we see this with the Asian American community during COVID-19, specifically with those who are East Asian presenting. Already, our communities were less likely to seek health and other supports and services, but now the issues are even more dire. Our community's lack of access to the supports we need have resulted in negative health outcomes and an overall underrepresentation of the pandemic's impact on our community. And our CBOs, our community organizations, they continue to struggle under-resourced to meet the constant needs of our community. And Vanessa shared a little bit about this right earlier, but I wanted to share that we are super thankful for the efforts of our partners and the APA task force, especially Senator John Liu is here joining us today, as well as Assemblymember Yulene New, in advocating for the inclusion of $10 million in this state's budget this year to directly support the critical life-affirming work of our Asian American community-based organizations across New York. And for $3 million for Asian American data disaggregation, we continue to advocate that the $10 million really reach the community organizations as the funding was intended. So I'm going to pause here, and I just want to acknowledge that Senator Liu is here with us, Senator Biaggi is here with us, Assemblymember Simon is here with us. I wanted to pass it off to you to say a few words. And so maybe in that order that I just shared, maybe Senator Liu could start us off. Thank you so much for joining.
Well, it's great. Thank you so much, Kaveri, for making the arrangements and for organizing this. And always thanks to Anita and Vanessa for their ongoing leadership. CACF has stepped up in ways that I would never have hoped that they would have had to step up, because these last year and change, maybe 15 months going on now since the COVID crisis really hit us hard, and the APA community even harder with a secondary virus of hate and bigotry. It has been a time when our community has faced struggles that honestly I thought were long in my past, but really the racism that has reared its ugly head so often these past 15 or so months has been bad, but could have been far worse if not for the efforts of CACF and all the member organizations. We need to make sure that our community is on stronger footing. If we were on stronger footing in the first place, we would have faced less racism and hate and fewer attacks. It's my firm belief that these attacks and the racism they're based in ignorance and fear. Fear because there's been so much death and pandemic and economic and job loss as well. And ignorance because unfortunately people still don't know a whole lot about our community, the Asian American community. And when you combine the fear and the ignorance, that leads to the worst possible recipe, which our community has been bearing the brunt of. So it's really, thanks for mentioning the state funding that Alessandra and Yulene and I think and Joanne has been very supportive as well. Assemblymember Ed Braunstein, represented by Amber Yu here. They've all been very supportive in getting this. It is money that should have been provided a long time ago to our organizations, because then we would have been on a sounder footing. We would have faced fewer hate crimes. There would have been less ignorance about our community, whether it be the model minority myth, or the even more heinous perpetual foreigner syndrome, or the straight out racist yellow peril concept. We need to do better. So I support CACF. We don't necessarily agree on every single item. Vanessa and I go back 20 years, and I got my share of scars from her, I don't want to say attacks, her advocacy, right? And I think nonetheless, I am fully supportive of what CACF has stood for and has done for so many decades at this point. By the way, since you have this Advocacy Day, there are issues. I know you're fully on my bill, which seeks to really educate the school kids of New York State about the Asian American experience, the history, accomplishments, as well as the ongoing struggles, and also and a number of other issues pertaining to our immigrant workers and family services. But there's the funding that you spoke about, we only just began. So there is still a lot more work to be done to make sure that that funding actually winds up in the places that can strengthen our community. And so we're having ongoing discussions about how to get that done. and look forward to continuing to work with all of you. Have a great day, and thanks for doing this.
Thank you so much, Senator Liu, for those words. Senator Biaggi, did you want to say a few?
Yes, I would love that. And I'm so happy to follow my friend John Liu, Senator Liu, who I know that all of you probably already know this, but this year and really all of the time and any time that he was able to, he was fighting for this funding in almost every way possible, and also doing it in a way where everyone else felt galvanized. And it's not to say that the rest of our colleagues could not be motivated just simply by turning on the news and understanding all of the hate crimes and the violence happening in the AAPI community, against the AAPI community, I should say. But I say that because I want you all to just know that you have really an incredible ally and friend and leader in the state Senate in John Liu, and also in Yuli New, and many others, but I named both of them because they were just relentless in the best way possible. And I think that when we're talking about just awareness, and John mentions ignorance, I mean, these are the things that it is so frustrating as a leader in the community that this is something that we have to even be discussing. But to John's point, it has been decades where really funding has not gone to the AAPI community for many reasons, some of which I am sure are political. I will not get into that today, of course, but the point is now they are. And that means we don't go back. It only means that we go forward. To John's point, this is the floor. Let's continue to go towards a future where the funding and the resources and the attention and the education is really limitless. So I feel grateful to CACF for having me here today. I represent a really large part of the Bronx and Westchester County. So I get to see a lot of issues in many different lights. And I think that makes me it humbles me for sure. And it makes me a better leader because I'm also able to push back in places in the district I represent, push back on old myths or tropes or fears or ignorance in a way that I know it's transformational, even if they're mad at me at the time that I'm pushing back on it, but I know that I'm planting a seed. And I think that part of being a leader today is really making sure that we're being mavericks in spaces that people didn't want to go into and talking about the things that really matter the most. And so I appreciate you all including me here today. I'm excited to listen because I always find that there's the commitment to education is a lifelong commitment. And so just thank you. Just a few more things, and then I'll, I'm sure, hand it over to my other colleagues in government. But I think that because of the rise in anti-Asian racism and violence, I think that, again, not only can this be a moment where we are reflective and thoughtful and strategic about how we are going to eliminate hate in the AAPI community, but I feel like this is an opportunity to coalesce. John mentioned this, and it's also been referenced a few times, but it really can't be said enough times. In the state budget this year, a budget that I can actually say with confidence that I am proud of. I have not been proud of our budgets in the past 2 years. I'm proud of this budget this year. Because of the rising levels of hate crimes, we allocated $25 million additional dollars for the Securing Communities Against Hate Crime program, and then $10 million that will be distributed to community organizations so that they can be able to address bias and curb crimes that have been committed against the AAPI community. This is money, again, that is just the beginning. It's just a start. I think that in Albany, I know in Albany, we pass bills and we put dollars towards things that we care about and we value. And so we have to fight for policies that address all of the existing inequities that are found in healthcare and education and criminal justice and in many other systems. And so for us to build a better future where every person feels safe and valued, we have to confront head on the anti-Asian racism that is prevalent throughout our community and also in our laws and in our educational system. Because the fact that I am 34 years old, and have been fully educated, and there are things about the history of this country that I am still learning about, that is a failure. And so we've got to do better. And it means telling the truth. And people are going to be upset by us telling the truth, and that is okay, because that is the place that we will grow, and it is the place that we will make the most transformational change. And so I'm looking forward to listening and being an ally and doing everything I can to really support the programs, the legislation. John, I will be signing onto your bill if I haven't already put my buck slip in to do that. I'm here to help and to listen and really to call out the racism and the violence and the lack of compassion that exists throughout, unfortunately, our world. And sometimes it's really hard to respond to violence and to hate in a loving way. But I do know that when I can access that, and when all of us can access that, it is the most transformational way forward. So thank you so much.
Thank you so much for those words. Yeah, and I really want to sort of highlight, especially what you said about the myths that have been pervading throughout, our society, throughout our country, throughout our state, throughout our city. I think one of the things that's really come up is the fact that, anti-Asian racism is not a new phenomenon, right? It didn't just appear due to the pandemic or due to the previous presidential administration. It's really been active for a really long time. We have seen racism against South Asian and Muslim communities after 9/11. We've seen racism against Southeast Asian communities for many years, particularly those who are lower income or more marginalized. And so just highlighting that part of what you said, Senator, and just, we have to be sure to be supportive of our community. And like you said, this is really the floor, not the ceiling, because we know that, these issues have pervaded for many, many years. So thank you so much. Finally, I want to pass it over to Assemblymember Simon for just a minute, and then we will get started on our program. We have a lot of really exciting speakers here from our membership organizations, folks who are doing really, really critical work on the ground. So I want to make sure we have enough time for them too. But please, Assemblymember Simon.
Well, thank you. I take your hint.
Yes, it was, I'm trying.
And I will be brief. So I just want to thank you for holding this teach-in. Thank all of you at CACF for hosting this and for teaching everybody what we all need to know. And as a civil rights attorney, the one thing that I have learned over the years is that fundamental to discrimination and bias is a lack of understanding. It's ignorance. It's a lack of familiarity with the people who are the subjects or the victims of this kind of conduct. And so educating people is the most important thing you can do. There are ways that we can protect the community. Certainly, I'm very supportive of the money that we were able to provide this year in our budget. It's a long time coming. But also, for example, some of the laws that we have that are there to protect people when bad things do happen. And so one of the things I'm just introducing is a new hate crimes bill, for example, that will fundamentally change the way we are able to prosecute and charge these crimes so that we are able to be more successful in prosecuting hate crimes, which has been a problem as well. And I don't want to focus on that, but I do think it's something that we need to also address and make sure that our laws are more progressive in that respect. So I'm happy to have done that, and to just say that you can count on my allyship. I think we all need to be much more intentional about how we are allies, and I am looking forward to learning from you today. Thank you so much.
Thank you so much, Assemblymember. Let me pass it off to our first speaker. So really, I quickly just want to introduce that our speakers today are amplifying our coalition's calls for solutions in New York that would address root causes, right? That are really necessary for our community's recovery and healing, that are all about building public health, education, and other systems that can support Asian American communities that are most in need. These include calls for language justice. They include calls for cultural responsiveness, pro-immigration policies, and policies that hold systems accountable for equity across communities of color. So I want to first focus a little bit on cultural responsiveness. We're going to have Kavita Mehra come in from Sakhi for South Asian Women, followed by Eric Agarijo from the Korean American Family Service Center to speak a little bit more on the importance of cultural responsiveness when it comes to working with Asian American communities. So Kavita?
Hi everyone. Thank you so much to everyone at CACF for hosting this conversation, and thank you everyone for joining us today. I will be brief because that is, I know that there are a slew of speakers, but I wanted to highlight in particular a survivor that we work with, because this case has been eating away at me since I have come to understand the recent developments. So there's a survivor we work with. I will refer to her as Luna. That is obviously not her name. And Luna is someone who has been with Saki for many years now. She left the person who inflicted harm onto her several years ago, and Saki was a catalyst in supporting her through that process. And oftentimes people assume that when a survivor leaves the person who's inflicting harm, that there is this pot of gold at the end of a rainbow, and that's it. You know, the bow is been set and their life is all good to go. But clearly that is actually just not the case. So what Luna experienced was that after she left the person who has inflicted harm, and she is living in a safe place with her children, she moves into an apartment of her own. And there she is experiencing sexual harassment from her landlord. And it becomes so persistent that she has to actually leave her apartment, and she can no longer feel safe there. She works with Saki, and Saki then is part of her support system in underwriting her housing for 2 years, where we are still underwriting her housing through our transitional housing program. While she has been in our transitional housing program, she has continued to pursue professional development opportunities, and was able to find really strong employment at a restaurant partner of ours. Through the course of the pandemic, she lost her income. Fortunately, she still has stable housing for herself and her children because of our work through the transitional housing program. And now it's become aware that she is unwell and that she actually has pretty severe cysts growing. And we now have to find a doctor that will work with Luna to support her through her other component of her healing journey. I'm sharing all of this to say to you that, you know, racism shows up in a host of ways. It shows up in ways in which it's structural housing. It shows up in ways of not having stable employment. It shows up in ways in which folks don't have access to equal health care. And I wish that we could be in a position where Saki didn't have to exist, where Saki didn't have to be the conduit to all of those resources in order for Luna to be able to just get basic services. But unfortunately, Saki is around to do that. And we work with survivors of gender-based violence in the South Asian diaspora. But what we realize is that what we see as trends are trends that the immigrant community, the Asian American community, continue to have to fight towards and consistently see. And so I'll pause here just to amplify the fact that the work and the lives that we, with the survivors that we work with, faced multiple forms of trauma. And all we're asking for is for our humanness and for our equity to be built in to consideration when laws are passed, when funding is offered up, and when changes, we're at that point where change is just truly needed.
Thank you so much, Kavitha, for sharing that story. I think it's so important, especially in our advocacy too, to really uplift those individual stories of folks on the ground who are experiencing the real world consequences of the policies that we have. And in turn, seeing how policy change can, again, really affect people on the ground specifically. So Eric, I would like to turn it over to you to speak more on this topic of cultural competency.
Well, first and foremost, thank you very much to CACF and everyone involved for hosting this. Once again, my name is Eric Agarijo. I am the communication coordinator for the Korean American Family Service Center. KFC provides social service to immigrant survivors and the children who are affected by domestic violence, sexual assault, and child abuse for the past 32 years. All of our programs and services are offered in a culturally and linguistically appropriate setting. 98% of our clients are immigrants, and 100% of our staff members are immigrants themselves or children of immigrant parents. Over 95% of our clients' first language is not English and come from low income backgrounds. So why I'm stating is because obviously the topic that I'll be speaking today will be the cultural competency and the cultural nuances and cultural cues, helping our immigrant survivors navigate in this US system and the need for language access. And what I did want to share is we do have this Hodori after school program that we're very fond of. And when in May 2020, KFC immediately pivoted our Hodori after school program to virtual classrooms and learning. So prior to that, it was always on-site, it was always person-to-person tutoring. And as an after-school program that serves 100% immigrant or children of immigrant parents who live under the poverty line, the support of KFSC's Hodori program program is critical. Many of our families are digitally illiterate and limited English proficient. Thus, our teachers and program coordinators work additional hours to provide technical support for remote learning in a linguistically appropriate way. For immigrant families with school-age children, the shift to virtual school has been overwhelming. Many of our families had difficulty accessing resources that are available to them. These challenges are then multiplied when there is more than one child in the family, and especially in the presence of family violence. Hodori teachers are also providing virtual tutoring sessions to assist with assigned homework. With schools in New York City closed since mid-March last year, there are serious issues regarding learning loss, which is then magnified for immigrant children in income-low households with unequal access to digital learning. Furthermore, immigrant families were disproportionately affected with the shift to remote learning. So the Hodori after-school teachers spending extra hours to bridge the digital gap. Many of our families have multiple children, and with the multitude of layers of trauma that they're already suffering, and trying to navigate the language access has been troubling. So not only were families hindered by lack of digital devices access to internet, they have been facing new web-based platforms like Google Classrooms or Zoom, which required many additional hours of tech support and training. So the Hodori After School program continues to operate via online, and we still have students that can't participate today because they don't have the proper support at home to help with remote learning. So challenges due to limited English proficiencies really already exist in these issues due to family violence at home, poverty, and cultural differences. But the COVID-19 pandemic and subsequent closings of schools and businesses highlighted these gaps even further. So I did want to highlight the scope of the nature of our program. This is one of our multitude of programs that have been affected at KFSC. I thank you very much for your time today, and we look forward to working with all of you.
Thank you so much, Eric, and thank you both for all of the work that you do to support our communities. I want to highlight that sort of education piece that Eric has brought up around how important cultural competence, cultural responsiveness is in our schools, and language access as well. One of the bills that we are supporting during our state advocacy here today is S273, which would establish and integrate a culturally responsive education curriculum and standards, as well as appropriate funding to develop a pilot program to do so, to really make sure that those cultural responsive standards are seen and are visible in every school. And also really highlighting Senator Liu's bill that he brought up earlier today, S6359A on Asian American history and civic impact being studied in schools as well, to make sure that, again, our communities are not invisibilized, that they're really explicitly covered in the curriculum, and that students across our state understand sort of the rich history that we have, the rich solidarity that we have with other communities of color. Just make sure that, they know the history. So now I'm going to turn it over a little bit to a slightly different topic, but still very related, because many of the issues that Eric and Kavitha brought up, are often hidden due to the model minority myth, right? Due to this idea that Asian Americans don't struggle or don't face challenges. And we know that, any response to crises must be based on sound data information. And because our community stories have for years been erased by the lack of data disaggregation in terms of race and ethnicity, our community has really not been served adequately and not been targeted with specific policies that will support them. Really, data on Asian American populations during the pandemic especially has been patchy, incomplete, and at times non-existent. And without this disaggregated data, it might appear as if Asian Americans as a whole are not struggling despite what we know are widening disparities within the community. And as we've highlighted a couple times so far during this teach-in, this year's budget really includes $3 million to fund disaggregation in Asian American data, which is a step forward that we're working on together with the state. So I'd like to hand the mic over now to Dr. Stella Yee from the Center for the Study on Asian American Health, who will touch briefly on how racism affects the Asian American community at multiple levels of society. So Dr. Yee.
Okay, thank you, Kaveri. Give me just a minute. And I apologize, I have to like drop off immediately when I'm done because I have school pickup. But let me pull up my slides. Okay, all right. So can everyone see that? Okay. So we just heard a bit more about the recent violence and Senate action in response to these recent violent events. However, as Kaveri mentioned, hate crimes against Asian Americans are only one part of the racism currently being experienced by Asian Americans. For example, in our COVID closure study, we found that food businesses in Chinese ethnic neighborhoods in New York City were disproportionately affected by the COVID-19 pandemic in terms of the greatest proportion of closures and the largest number of businesses. And this was true within each category of food business, including restaurants, grocery stores, and produce vendors. 40% of fresh produce vendors, which are an important source of culturally appropriate produce for neighborhood residents, were absent in the Chinese ethnic neighborhoods at the time of our assessment. Utilizing an agent-based model previously developed by my close colleague, Dr. Yan Li, we simulated that fruit and vegetable consumption among Chinatown residents would be reduced by nearly 20% as a result of this impact on the produce vendors, further challenging the food security for this community. Our follow-up assessment is currently underway, and we will have further results to share soon. We have learned from national partners that the xenophobic shunning of Chinatowns is a worldwide phenomenon, with outsized impacts being reported in San Francisco, Los Angeles, London, Yokohama, and Melbourne. Despite this evidence, however, Chinese ethnic neighborhoods are surviving more based on grassroots efforts rather than government support. Most PPP loans have been awarded to restaurants in majority white, Black, and Latinx neighborhoods, and the red arrows indicate where Chinatown and Sunset Park, which were in our assessment, fell on the spectrum of PPP loans awarded to restaurants. And this is not just true of restaurants. This map displays all PPP loans that were distributed last year. You can see that the majority of businesses were located in Manhattan, and all top 5 are majority white, higher socioeconomic status neighborhoods. This stands in contrast to the bottom 5 receiving neighborhoods, which we know to not only be predominantly ethnic immigrant neighborhoods, but also disproportionately affected by COVID-19 infection and death. Asian Americans have been strangely absent from media reporting of such economic devastation and in the published scientific literature. For example, between May and December 2020, there were 184 articles with the keywords Asian American and unemployment in major US media outlets, but greater than 1,000 and 5,500 unemployment stories involving the Latinx and Black communities, respectively. Asian Americans have also been invisible in research and the published scientific literature during the COVID-19 pandemic. This points back to the broader and historical issue of the lack of data on Asian American communities in general, and the fact that Asian Americans are the most understudied racial ethnic minority group in the US. 0.01% of Medline articles included any Asian Americans in the study sample from 1966 to 2000, and 0.17% of the total National Institutes of Health budget funded research studies focused on Asian Americans, Native Hawaiians, Pacific Islander populations from 1992 to 2018. In addition, when data are presented on Asian Americans, it's often presented in aggregate form, even if disaggregated data are available. Concerns on the lack of clarity on the impact of the COVID-19 pandemic on specific Asian American communities led us to work with colleagues at the New York City Health and Hospitals Corporation, the largest public hospital system in the country. We examined roughly 85,000 patients that had been tested for COVID between March and May. In this analysis, we applied surname matching to to classify misclassified Asian Americans, which nearly doubled the sample size of Asian Americans, and allowed us to characterize specific Asian American groups, including Chinese, South Asian, and other Asians, which included Filipinos. What we found was that South Asians, which are in blue, had high rates of positivity and hospitalization due to COVID, and Chinese Americans in the red had the highest mortality of all racial ethnic groups, disparities that were not observed in the aggregated Asian group. Through multiple sources, we have pieced together this information about how disaggregated Asian American subgroups are experiencing the COVID-19 pandemic. This resource helps one to appreciate that despite there being some commonalities across Asian subgroups in their experience of the COVID-19 pandemic, for example, facing challenges due to limited English proficiency or fear of public charge, it also highlights just how different each subgroup is as well. And by the way, this aggregation into one category is not just a problem for Asian Americans, but for all racial ethnic groups. This quote from Americana sums this up. Dear non-American Black, when you make the choice to come to America, you become Black. Stop arguing. Stop saying I'm Jamaican or I'm Ghanaian. America doesn't care. Our team is actively working on improving data collection and reporting for all racial ethnic groups. Currently underway is a systematic review to understand methods to address misclassification and missing race ethnicity in administrative data sets. This review is in process, but to date we have screened roughly 1,900 abstracts and 77 articles are being included in the final review, which we anticipate will be completed at the end of the summer. Algorithms described in the literature utilize primarily surname or last name and other methods. Notably, we have encountered work for improving classification for a number of racial ethnic groups, but limited work on improving classification for persons with African ancestry. Leveraging the experience of our national policy partner, the Asian Pacific Islander American Health Forum, CACF, and the New York City Health Department, we're also continuing to support advocacy efforts around data disaggregation and adopting new measures for use in our own work. This is a working draft and a sample of the new questions on race ethnicity that we're considering. These findings are helping to inform data collection best practices at NYU Langone Health, have been shared with our colleagues at New York City Health and Hospitals Corporation, and with CACF, we are in discussions for these recommendations to be applied to data systems in New York State. So why does it matter? Data analyses are an important starting point to planning, resource allocation, and policymaking. To illustrate this, I put together this non-exhaustive representation of a cascade of events that starts with a primary data source, followed by analysis, and eventually leading to funding allocation, policy, and complex modeling. If racial ethnic minority groups, including Asian Americans and disaggregated subgroups data, are not included at the outset, then it essentially stymies the representativeness of the entire pipeline of future research and practice. This systematic lack of data will perpetuate the continued mismatch between the health research literature and the growing diversity of the US and ultimately the health of the nation. In closing, racism against Asian Americans is a structural systemic issue at the neighborhood level, within media, within research and data. Our recommendations are to address implicit bias about the Asian American community at all levels of society through education and training, and to invest and improve, to continue and invest in improved standardized data collection and reporting practices of race ethnicity. Thank you, everyone, and I will stop there.
Thank you so much, Dr. Yu, for that very, very informative presentation. I always enjoy hearing and seeing your slides because they're just so impactful. So, you know, everything that Dr. Yu shared is one of the reasons why we are advocating for Assemblymember New and Senator Salazar's desegregation bill. Bill numbers are A6896 and S6639. We are really looking forward to hoping that that passes this year. We also want to say thank you once again for the investment, $3 million into data disaggregation, into the budget. And look forward to working with CISA and other partners with the Department of Health to really push that forward and make that a priority and implement it. Now we're going to transition into the importance of public health. I think this really speaks again to what Dr. Yu was sharing, and really its definition beyond only health access. So we have Carlin Cowan here from the Chinese American Planning Council. Carlin, are you all set?
Hi, everyone. I'm going to take off my New York Health Act mask because, as you all know, we are making a major push. And I know that some of the folks on this call have been a big part of pushing for guaranteed universal health care for all New Yorkers. But we also know, and especially Asian American community-based organizations that have been doing the work on the round, that health access goes so much guaranteed healthcare. That is an incredibly important part of it. Obviously, at CPC, we know that 1 in 5 community members that walks through our door does not have any kind of insurance. And that was before the pandemic. We've seen so many community members that have lost healthcare coverage during the pandemic. And even of those community members that do have insurance, so many of them are underinsured. Our caseworkers sit with our community members and help them make decisions about refilling critical prescriptions or putting food on the that. We know that a key part of this fight is fighting for guaranteed health care that covers all New Yorkers regardless of status. But we also know that we have to do so much more to actually make sure that healthcare is accessible to our immigrant community members. One part of that is language access, and that's incredibly important. When we navigate the healthcare system and English is our home language, it is still incredibly complex and difficult navigating referrals to specialist care or care instructions, discharge instructions, anything like that. That much more complicated. And I know that I am preaching to the choir on this because everyone on this call has experienced this in our own community-based organizations. In New York City, Asian Americans have a 42% rate of linguistic isolation. That means that of anyone in the household over the age of 14, nobody speaks English very well. That is higher than any other racial or ethnic subgroup. And while services like Language Line are important, at CPC, community members that have waited in doctors' rooms and hospitals trying to get in and for hours, well beyond the time of their appointment, well beyond the time of when their public transit might be coming back for them. They've waited for hours on Language Line and gotten transferred to a translator that doesn't speak the correct dialect or even the correct language. And so we know that ultimately that's not the solution to language justice in healthcare, but that language justice actually has to be centered in our communities, from our communities, and with our communities. And that's one of the reasons of bills that we're here to advocate for today. And I know that my dear colleague Mon-Yuk is going to speak about this a little bit more later about the importance of language access. But we also know that in addition to language access, cultural responsiveness is a critical part of this. Because yes, language access is important, but if that language access is not also responsive to the individual cultures of our community members, is not done in a way that is either culturally accessible, culturally responsible, culturally responsive, then our community members are not receiving the health care that they need and they should have. And trust is incredibly important in actual high quality healthcare provision. If community members cannot trust their primary care providers, their specialist providers, or even have trust in the unfortunate cases of emergencies, then they can't actually receive the kind of healthcare they need. And that could actually be a life or death matter in certain cases. And so that's why it's so important that when we think of healthcare, we really think of these 3 components: access to the actual healthcare instead. We have to fight for transformative changes to our healthcare system to make sure that we're removing barriers to healthcare access for all of our community members, regardless of financial status, employment status, immigration status. We need to fight for language justice in our healthcare system, not language as an afterthought, but actual language justice. So healthcare systems that center all of the diverse languages we speak, not just the top 10 languages, but all of the languages that New Yorkers speak. And then cultural responsiveness. So a healthcare system that takes into account our individual cultures, our relationship to healthcare and medicine, and puts forth dignified care with that in mind. I'm so proud and glad to be here with all of my other community-based organizations,
of course, CACF for bringing us together for this incredibly important Advocacy Day. And the elected official partners, thank you so much for being here and for always fighting for our communities. Thanks again.
Thank you, Carlin. Thank you so much for providing that sort of really broad painting of our needs in our community. I think it's really helpful for that framing, just to see like how diverse the needs are, how different the needs are, and how expansive they are. But I think this was a perfect transition to Monyuk. So I'd like to introduce Monyuk Yu, the Executive Director of the Academy of Medical and Public Health Services, AMPHS.
Thank you so much to CACF for this opportunity and for organizing this platform. The Academy of Medical and Public Health Services is a community not-for-profit organization in Sunset Park that bridges the health equity gaps for uninsured immigrant populations, many who are undocumented and otherwise will not be able to access healthcare services. We offer interventions in healthcare, social service, and adult and health literacy, free of charge in regards of immigration status using a community health worker model. Community members come to community-based organizations like AMPS because we provide a safe space to communicate their health needs in their own dialects. What we hear time and time again is that community members are regularly turned away or detracted from accessing healthcare services in healthcare institutions because of the lack of language access. Ms. Chen, for example, is an undocumented community member who speaks the Fujianese dialect. We've been working with her for several years at our organization. When we referred her to a local hospital, they didn't have anybody who spoke her dialect. As she watched her English-speaking counterparts get called for their appointments, she was asked to wait 2 hours to simply be connected to an interpretation line, only to find out that the person on the other line didn't speak her dialect. And at the same time, when a mass vaccination hub was set up in Sunset Park, a majority of where we have a majority Chinese and Spanish speaking community, there were no on-site interpreters, no translated signage, and providers scrambled to have community members interpret for one another, jeopardizing information accuracy and HIPAA patient confidentiality. And Mr. Wong, who is an 85-year-old Chinese speaking man, was asked to wait 2 hours at the vaccination site in February, was ignored and told to stand aside. He eventually left and said, "This is too frightening. I don't want to get vaccinated anymore." And when we think about what contributes to vaccine hesitancy, what contributes to this fear of healthcare institutions, it is exactly this type of lack of language access and support for our immigrant communities that creates a stark dichotomy between the way that our communities are treated in healthcare institutions. We're multiplying the fears that community members face due to immigration threats like public charge and discouraging them from accessing important healthcare services. And not to mention, for community members who are low English proficiency speakers, they may go to a clinic, not be connected to an interpreter, and be told inaccurate or understand inaccurate information at a doctor's visit, jeopardizing their health. And as my colleague Carlin had put it so well, there is a significant need to ensure that we have adequate language access so that our communities are protected, so there is health justice, and so that we can ensure that we are bridging the gaps to health equity. Immigrant populations have grown significantly, and so have our languages and our cultural needs. And this stands not just for our AAPI communities, but for all immigrant communities. Data disaggregation is needed to better highlight these language needs in our local healthcare institutions so that we know how to properly assign our resources, especially for these lesser known dialects and indigenous languages. And more resources need to be invested in community-based organizations who assist with language access, especially in community health worker programs, which work to bridge these language access gaps. And it should not be the responsibility of a family member to interpret at a healthcare facility. It should not be the responsibility of a community member to have to refine their English speaking skills in order to communicate with an interpreter, in order to communicate with a healthcare professional. But it is our responsibility to ensure that there is adequate support so that we can make this health system more more equitable for our immigrant community. The lack of language access is healthcare racism, and we have to transform the system to promote healthcare justice for all.
Thank you so much, Manyak. Yeah, I think what was coming up for me when you were sharing that was also just like connections to education equity, connections to racism in education, and the fact that a lot of these language barriers that we continue to see in the healthcare world, we also continue to see in our schools, in our public schools. And, even if there is sort of an effort from certain school districts to sort of promote language justice, we still see way too many incidents of, let's say, limited English parents not being able to access parent-teacher conferences or not feeling comfortable in their school environments because they don't know that they have the right to be served in the language that they speak. So again, we are supporting also the passage of S635 and the Education Equity Act, which is S1429 or A407, which really requires school districts to establish a language assistance plan to make sure that our limited English proficient community members are prioritized rather than treated as an afterthought. The other thing that really stood out for me, Manyak, what you were talking about is how important our connections are with other communities, right? Other communities of color. The fact that actually pretty much all of the legislation that we are fighting for and the stories that we tell are very, very relevant to the communities of color that we work with every single day. So, to address the structural roots of our community struggles, which are ultimately steeped in racist and white supremacy culture, we have to stand in solidarity across Black, Indigenous, and other communities of color. And Asian Americans have actually had a really rich history of fighting together for justice, and that has to continue today. So I'm going to pass it over to our final incredible speaker of this afternoon, Cameron Nunn from Mekong, and he's going to join us to speak a little bit more about the solidarity work amongst communities of color and why it is so vital to our efforts here today and moving forward.
Thank you so much for that. And I just hearing folks speak and share and naming all of these issues, I think it just speaks to the amount of work and amount of history and rich history of what it really means to organize, to be in solidarity with other communities of color and really naming root causes of those things. So Mekong, we organize the Southeast Asian community in the Bronx and throughout New York City. And so for us, our organizing model is at the intersection of healing and organizing. We have a health justice lens. And so our community has that history of really unpacking what war, violence, and genocide looks like. And so for us, that was like, the gateway and the platform in which we really wanted to address what are the needs of our community. And then when we talk about public health and we talk about root cause, we expand and talk about, health and well-being and what does that mean? Sharing earlier around the social determinants of health, I think was a great platform and a great tool of really talking about like, what are all the other communities of color dealing with? Who are the ones who are most impacted? Who are those who are most harmed? And throughout history, we know that, communities of color, Black and Brown, Indigenous people of color are the ones who are at the forefront of that. And so when we talk about social determinants of health and when we talk about what racism looks like in public health, this broader concept, I think we really need to understand those struggles. Born and raised and coming from the Bronx and understanding those culture and diversity, I think we really need to understand what does that mean, right? Talking about not being able to provide food, on the table, not being to be in a safe home, having heat, something to eat, being able to provide and pay for bills. All of these things have impact on our health and well-being. And so for us to really like think and understand like, why is that the way it is and where does it come from? Access to food, food pantries. I think what we've learned, especially during this pandemic, just really highlighted all of these things that we've known for generations and issues that we continue to try to put Band-Aids on and not really addressing what those core needs are. And the other thing I think, when we talk about what is at the root of, public health and being able to provide healthcare and health access, I think is so important. Mekong, we, like many communities, community organizations that are here today are those safety net organizations that have to do and provide so much. And so like in the world of understanding, like, what does that mean for us? I think we really need to unpack and uplift, these issues and common struggles to tie very deeply in the work that we do with other communities of color. One of the things that we always in the office, the question that we always ask is like, what are we going to eat for lunch today? And it's like the hardest question to ask because just even providing, access to quality food, fresh food, healthy food, like even that whole spin of like, what does it mean to really take care of our body and our spirit, I think is really important to addressing like what the root cause are and what does accessibility look like in our community. One of the things that we've learned and, build not only in the Bronx, but through our work with CACF, coalition building and community organizing and advocacy has been such an important tool and such an important way to build solidarity with the communities of color. We talk about, what are some of the things that we're dealing with right now in this moment. And so as we're talking about all of the Asian and APA hate that we continue to see, this is not new. This is something that always happens throughout history. It's just our time is right now that are being focused in the limelight, focused and put in our TVs and our social media. And so, what our colleagues shared earlier, like, throughout history, when 9/11 happened, our Middle Eastern brothers and sisters were dealing with that, right? When the immigration wars were starting to happen, right? Our Latinx communities having to deal with that. And then continuously our Black and brown brothers and sisters are the ones who are at the root of it. And so that cycle of violence will always continue to happen. And so for us, like, we really need to talk about what systems and structures are actually impacting what that looks like. And so for us, coalition building, and especially some of the work that we've been able to do in the last few years, through multiple coalition efforts, naming root causes and naming, these legislative measures and making sure we're bringing these to our elected officials and uplifting these things are so important to the work that we need to do. And so, something that we always talk about is making sure the community is at the forefront of our solutions, making the point that these shared and common struggles are very tied to our history and our culture. But I want us to also think about and make sure that we're also problem solvers and we're decision makers as well. And so what are some of the things that we need to do to name those things in order for us to fight and advocate and organize, and making sure that it's not just one community that we're fighting for, it's a holistic approach that we want to make sure we're taking everybody with us. And so those are some important things that I want us to really think about and carry with us as we continue this fight, as we continue to fight for resources and advocate for our communities. We need to understand that all of us are shared and tied to each other's liberation. And so for us, it's so important to have platforms like these to talk and share stories and how community members are impacted, but then also share that richness of history and solidarity that we have with all communities of color. Thank you.
Thank you so much, Cameron, for uplifting all of those really, really, really important points. I really appreciate your framing, and just to sort of connect it to the sort of legislative side, as a start to holding our systems accountable to addressing structural racism, we're supporting the passage of S2987 and A5679, which declares racism to be a public health crisis, and establishes a working group within the Office of the State Commissioner of Health to really promote racial equity throughout the state. So yeah, just wanted to bring it back to kind of what we're fighting for today specifically, but Cameron, I really appreciate that sort of framing of how we need to go about this work perennially and always. So we're coming to a close. Really appreciate all of you being here and learning with us and listening with us. And we just want to take a moment again to thank all of the tireless work of our coalition members, community organizations on the ground who are providing the really critical and life-affirming services that are culture competent, that are language accessible, that our communities really need to recover and heal from these challenging times. So thank you all again for joining. My apologies for the construction in my home, and have a great rest of your day. For those of you who are participating in legislative meetings, see you all soon. Thank you so much.